Today we have Pablo. You can see he's absolutely a beautiful tortoise, but what you should also note is that he looks very flat. And when we actually palpate his shell or carapace, top and plaster on the bottom, they are spongy and will move up and down. So he's overall very soft and very weak. He's also having trouble breathing, so when he's breathing, he's frequently bobbing his head and moving his shoulders. He's very thin. If you look at his head, there are no visible fat pads on his head. So this little guy is really struggling. And we did get some radiographs on him today, and I'll show you those in this video. So this is almost certainly metabolic bone disease. And this is nutritional secondary metabolic bone disease, meaning if we don't have the correct nutrition and the correct lighting, then what happens in reptiles is they'll pull calcium out of their bones to keep enough calcium in their bloodstream that they can survive. So with reptiles, they do require UV lighting. This guy hasn't had a new light in many years. And they do require calcium in their diet with supplementation needed. And unfortunately, this guy hasn't had that. And as a result, over the months to years, what he's done to try to just stay alive is he pulls the calcium that he has in his bones to use it in his bloodstream, because we do have to have calcium to be able to survive. And so over time, he's basically pilfered his bones and weakened his bones. And most of these guys end up with many pathologic fractures where their bone is so thin, it just kind of collapses or crunches on itself. And we very frequently will see this with advanced metabolic bone disease. And this is unfortunate because it is entirely preventable. I highly recommend, if you do get an exotic pet, it is vitally important that you do your research before you get them, and certainly when you have them, and learn as much as you possibly can about the animal and the species, so that you know that you're capable of meeting their needs and providing their needs over time, not just when you first get them. The good news is most of the time we can get these guys back to health. It'll take weeks to months, but it took a long time to get to this point. So we have to be patient, and the most important thing is provide optimal needs. So everything he needs in his diet, his environment, his temperatures, his humidity, to ensure that he doesn't have additional stressors. We will be putting this guy on injectable calcium. He is getting an injection of vitamin D. We are getting a new light. We've discussed diet, as he's only eating leafy greens now, nothing else. And the goal is to get him back to health. Even with bone fractures, these guys often will survive, and they can thrive when they heal. The bone is an amazing organ, and bones are able to heal over time, just like when we break a bone. So we basically just put him on cage rest, which is really all he can do right now anyway. So we keep him calm and quiet. With the lizards, we make sure that they're not climbing or falling. With the tortoises, we just restrict them while their bones are strengthening and healing. And then make sure that we're providing all his needs to be able to rebuild his bones, because truly his whole skeleton has to be rebuilt at this point. The respiratory concerns in these guys can be a couple of things. One, it can be overall weakness. And the other thing that we see very frequently in tortoises is when they're stressed or immunosuppressed, they will pop up with a tortoise herpes virus. Yes, herpes, it's a respiratory virus in tortoises. And they often have it all along, and when they get stressed, it shows up. And then mycoplasma infection is another organism that also does that. So we are checking him for those. We will be treating if he has mycoplasma. But our goal is to get him back to a healthy, happy tortoise that's strong enough to walk and function and live the long life that he should have. So please, if you have a reptile, it is vitally important you understand their needs and ensure you provide them. And with your UV light, put it in your calendar so you know when it needs to be replaced. Usually we replace them every 6 months. Depending on the bulb, you might be able to go a year. No longer than that. That's Pablo.